Scaling Technique by Tanya Rico and Arturo Espinosa. Scaling is a technique that helps both counselors and clients make complex problems seem more concrete and tangible. This technique was started by Steve DeShazer and arose out of the strategic family therapy. Thoughts, feelings, and behaviors are not always realistic or concrete. Scaling questions provide a way to move from these more abstract concepts towards a more achievable goal. The counselor can say, on a scale of 1 to 10, where 1 represents the worst and could be 10 represents the best things could be, where are you today? Scaling techniques give clients a sense of control and responsibility over their therapy because scaling techniques help the clients specify goals for change as well as measure their progress toward those goals.
How are you doing?
I'm doing good.
Okay, so last time we talked a little bit more about we touched base on your anxiety. Do you want to talk a little bit more about it today?
Yeah, I guess it can be one of the subjects that we can touch.
Okay. So what about it?
I don't know. Well, I've been going through some classes, and we have to do presentations, and I just experience a lot of anxiety when I have to speak in public. I don't know how to deal with it. I feel like my heartbeat goes everywhere. I start sweating, my mouth gets dry. You know, I've been dealing with this since I was a child, and I'm almost 30 years old, and I just feel like I'm never gonna overcome this.
What is it that frightens you? Because it sounds like you're frightened by something. What is it that triggers it?
I guess just the fact of messing up in front of a group of people.
Okay, so let's say you were to mess up. From a scale from 0 to 10, 0 being not that bad, 10 being the worst, how bad do you think you would mess up?
Can you repeat the question again?
Okay, so let's say you have to do a presentation. And you mess up. On a scale from 0 to 10, 0 being not so bad, 10 being really bad, how bad do you think you would mess up?
6. It all depends if I'm prepared for it or not.
Let's say you are prepared for it. You're fully prepared and you know what you're going to talk about.
Maybe a 5. I guess the more prepared I am, I guess it gives me like a little more confidence.
So then you drop down from a 6 to a 5. What's the difference between a 6 and a 5? So you mentioned 6 first, but then you went back down to 5. So why not a 6?
You know, like it could be the fact that I'm more prepared, and maybe if I'm more prepared, I won't stutter or anything. Like I'll just it'll be fluent, as opposed to like if I'm not very prepared, then it'll make me stutter a little more, and then from the stuttering I'll start sweating and so on.
Okay, so if you were prepared, you're rating it as a 5. Let's say you weren't prepared. You didn't even know what you were going to go up there and talk about. What would you rate yourself then?
A 10.
A 10. That's really high. So that's pretty high up there. So what is the difference between a 5 and a 10? Of course, it's being prepared, and then the other one's not being prepared. But in your feelings, what's the difference? What are you feeling then?
I think at that point I just want to run away from that place and just not continue with the presentation.
Just that?
Oh yeah, after having all the other symptoms and already not knowing what to do, I won't even want to be there at that point.
And that's in the case of not being prepared. So how fully prepared are you for your upcoming presentation?
prepared, the thing is that even being prepared, there's still a level of anxiety. It'll never be normal.
Well, it won't. But then you also have the fact that you're not prepared at all. So you're preparing, correct?
Mm-hmm.
So then if you're preparing, you have that sense of at least some sense of being comfort, or the sense of comfort of being prepared and knowing what you're going to go up there and talk about. Of course, it's not going to take away the anxiety, but overall, you're prepared for something. You know what's coming.
Mm-hmm.
So now thinking about the fact that you're not prepared at all, that would be the rating of a 10 that you gave earlier, going back to the one if you were prepared. So now that you think of it, how do you feel about this? Does it still stress you out?
It's gonna happen regardless.
Well, it is. It's going to happen regardless because you have that. You even mentioned it. It frightens you to go up there and talk in public or and talk in front of a large crowd. But I'm talking about being prepared. So you're prepared for what you're going to go up there. Of course, everyone gets nervous, and it's normal. It's okay. It's okay to be nervous. But being prepared versus not being prepared, how does that make you feel?
I mean, it makes you feel better. Yeah, in a sense, but yeah, I get
Mention
you.
that it's still going to happen regardless.
Mm-hmm.
Okay. But let's say it doesn't happen. Let's say that the whole thing here is not just your anxiety, but it's also just the fact that you're not prepared or you're prepared. Minusing that, if you're prepared versus not being prepared, how does that make you feel? Not going in the future and thinking about it's gonna happen.
Yeah, there's gonna be a big change.
It's gonna be a big change.
Right.
So it's gonna give you a little bit more confidence.
Of course.
Being able to be prepared, obviously.
Yeah.
So then, what is it that you feel you need to do in order to avoid that sense of anxiety?
Being extremely prepared.
Which is, how do you prepare yourself for something you need to do?
Make sure I know the information.
Okay. So do you feel that that's something you want to practice on? Maybe on your upcoming presentation?
Yeah.
Okay. So then we'll practice on that. Go ahead and do that in your presentation. And then on the following week that we meet, you can go ahead and follow up and let me know how that happened.
Okay.
Yeah?